Well, for all Trina's friends and family that don't live here, we thought we would do a video so they can see for themselves how awesome she's doing. So Trina, how do you feel?
Feel like $1,000,000.
And you're working really hard, I hear.
Working hard to lose weight and get off insulin.
So what all are you doing?
Like I wake up and I have to weigh myself every day and I have to report if I gain weight. And then I take my blood pressure and temperature to make sure I don't have an infection, and I have parameters for my blood pressure. It has to be okay. I've been fine with my blood pressure. And then I check my blood sugar, and then I take a long-acting insulin. I'm off of my regular insulin. I figured out everything I learned about diabetes is correct, and exercise works like insulin. So I eat and then I go exercise after every meal. Every meal? So I eat 3 meals and I try to exercise after every meal. Yeah.
And what are you doing exercise-wise?
All I can do is walk briskly, or they say I can ride a stationary bicycle, but it kind of hurts. My incision's not totally healed, and it makes you like put your knees in your chest, so I don't like that.
And how much weight have you lost?
As of today, 27 pounds.
Wow, great.
My goal is to lose 28 more. I want to lose 55 total.
And how often do you go to the doctor?
For the first month, I went every week to see the doctor, and then labs once or twice extra a week for that. But now I'm to my 2 weeks, so I can go. I'm going a week without for labs and 2 weeks to see the doctor.
And your medications. You brought your medications.
Yeah, I just wanted to show these. I have little pills, and I take them 4 times a day. Paul had been setting his alarm and let me know, and I have my phone alarm set too. But real important to take them at the same time every day. So in the morning I have a ton. At lunch and dinner, not too bad, and then again a lot at night. And these morning and night ones are the ones that are anti-rejection, so the immunosuppressants.
There's a lot of pills in there.
Lots.
Well, I mean,
so it's 12 different medications right now, and then multiple of the pills. So, and like these little tiny ones. This is Prograf. It's the most important one. I'm trying to get down to a lower dose. And the reason I have to take insulin is all of these, their side effect is to increase my blood sugar because I also have steroids. But this little pill for one little thing of these is $4,000 without insurance. $4,000.
For one pill?
For one bottle of pills.
One bottle.
For my prescription for 1 month. So with my copay, it's $35. Thank God for insurance.
Wow.
So I have great insurance.
Well, and will your medications always stay like it is now?
Yeah, hopefully it'll just keep winging down. The more winged down I get, the less like, I still have to always be cautious about being around sick people and kids that have just gotten shots, and like elderly people that tend to be sick more. The lower I go in the doses, the safer I'll be around them.
And so, do you have to take the immunosuppressants the rest of your life?
Rest of my life. If not, my liver would then reject. My body would kick it out. The only person they've ever found that was able to get off of them was someone who received a kidney from an identical twin. They did not need it. I think that's pretty cool.
And right now, how many do you have to take, and how many for
I take 7 of the Prograf and then 4 of a Cellcept, and then 17.5 of steroids right now. But I was already at a higher dose of all those, and I've winged down. My labs determine if I can go lower.
And you said $35 a month for that one pill. Do you know how much of all your medications together it's costing you a month?
Last time I think it was right around, they forgot to refill one, so it would have been around $150 a month. So the first month it was more because I had to, now I'm off that one insulin, so I need less syringes and less insulin stuff, so it's gone down a little bit. Hopefully I'll get off that. That's my goal.
So your fundraising, whenever we get back to that, will be for your medications, and what else?
Because they told me, think about this, that I'm projected to live probably to be 80. I have a normal life expectancy now, so that's, almost 50 years more of every month, all these copays. So I won't always have this great insurance. I won't always be working when I'm 80. Hopefully I'll be working when I'm 80. And so to think about budgeting that for the rest of my life.
And so far as restrictions for the rest of your life, is there anything permanent that...
Like right now I can't go to like a zoo or a farm and be around like livestock and poop, animal poop. Bird poop is the worst, where it's like contained in one area. I shouldn't be around that. And like Thomas right now, if I touch him for 8 weeks, I have to wear gloves and a mask if I get in his face because he just got shot. So people have just been vaccinated, and then even more so kids that don't get vaccinations. I can't really interact with them at all. because of they could, you know, if they had chicken pox, it wouldn't show up maybe until the next day, and if I was around them before, then I would have it. And as an adult, all those illnesses are really scary, and then much less if you're immunocompromised. It could put me back in the hospital real quick.
Well, so will you take vaccines yourself, like the flu vaccine?
I can have I can have any dead vaccine, no live vaccines.
So the flu is dead, I don't know.
Yes, it is. There's one, the one they inhale in your nose is not, but I can't do those. And like an MMR, a DTaP, any of those I can never get again.
And how will it be when you go back to work? I mean, so far as those kids...
I will always have to wear gloves, and around little ones, probably a mask as well when I'm interacting with them. And which really, as a nurse, I probably should put gloves on anyway. It's just you get comfortable around kids and think, oh, they don't have anything. So, but they could.
But even kids that have like vaccines and stuff, you could be around them as long as you...
I can't let their body fluid come in contact with me.
Okay. And so how much longer do they say before you can go back to work?
Well, the paperwork they filled out said May 22nd, which would have been, it'll be 3 months off. So, and I think once my incision's healed, I'd probably be like, okay, I'm probably not released to, at work I have to lift like 50 pounds or be cleared to lift 50 pounds, and I'm not there yet. And I think just the environment, being a nurse, they're kind of concerned with me going back and around kids, that the longer I'm out post-transplant, the less medicine I'm going to be on is the goal. So when I get to a lower dose, I'm sure they'll release me.
So do you think you'll go back around that date, or?
Oh yeah.
Okay.
For sure.
I mean, if it's early, it wouldn't be much earlier, probably.
Right.
And if it's later, not much later.
No, because it's already April. Well, tomorrow will be April. So.
Tomorrow will be April.
Yeah.
And I know your coworkers probably miss you and are ready for you to come back.
I stopped by and saw them after my last appointment, which was really nice. And I had to get they helped me with some supplies and stuff.
Yeah.
So.
Well, how is your incision itself feeling? I know you're a little surprised for everybody to get to see it later on in the video, but...
It's good. One side hasn't healed really that well. They didn't do any stitches or staples on the outside. They did internal staples that supposedly dissolve, but you'll see them, they haven't dissolved. And so it's almost like been healing from the inside out on one half.
Yeah.
So.
Well, and I hate to ask about the donor. I don't want you to get emotional about it, but at what point will you be able to contact them? What is that process?
So I write a letter, and I can include in the letter anything I want about me and my family, how to contact me, anything I want to tell them, and then I give that to my coordinator, and she passes it on to the life gift people, and they wait 6 months post-transplant to give it to the family. They give them 6 months, I guess, to kind of grieve and do everything. And then once it's given to them, the ball's in their court. If they want to contact me, they can. I hope they do want to contact me. I'd like to know his name so that I could say his name. No, I'd like to do something.
Do you know that it's a male?
I know it's a male and that he's very young. They still don't really tell me the age. And I think I could only have a 16-year-old or older for my body size.
Yeah.
But I would like to get to know them.
Yeah.
And I think about him a lot. I like to know what he looks like.
Yeah.
And yeah, so even if they don't contact me, I can send as many letters as I want. There's a story, one of my nurses in the ICU came and told me her husband had 2 lung transplants, and they never met either of their donors, but that one of the people in their group had written a letter for 10 years, 1 letter a year for 10 years, and after 10 years, they did meet. So, I'm just trying not to give up hope.
Yeah.
Yeah.
And what is the life expectancy, if that's not the right word, but of your liver? It should last you your whole life?
Yep, they said I basically got a brand new liver.
And with your autoimmune disease? I mean,
so the good thing is that with autoimmune, how I was treating it was with immunosuppressants. So some people can wean down. I might not get to the lowest dose that I could if I didn't have autoimmune hepatitis, because they never want it to rear its head again. Like, they want to keep it suppressed as well.
So it's not that you're cured of autoimmune, but it's better now than what it was before your transplant.
Oh yeah. Because by the time we even found out I had autoimmune, I was in stage 4 cirrhosis. So this is a brand new no cirrhosis liver.
So you're good to go. You don't have to worry about possibly
Anything.
facing another transplant someday, or?
As long as it, doesn't reject. And then the only thing I have to be really cautious of is anyone on immunosuppressants has a high risk of any kind of cancer. So now if I'm outside for more than 15 minutes, I wear sunblock. And if anyone knows me, I hated sunblock. But I wear it, it's in my purse, I have some for my face. And so me and Thomas lather up if we go outside. And I follow all the rules like they tell me to do. And I can't eat like at a potluck or buffets, anywhere where there's like lots of people around the food, because that's just germs. And some people do pick it up with their hands, and who knows if they wash their hands. So little stuff that you wouldn't think about, it's kind of, I have to think about people, and I'm not supposed to go in like really crowded areas where I'd be around, like the rodeo. They're like, you can't go to the rodeo this year. So that was livestock and a crowd. So just little things like that. It'll be a while if I can go to like a concert, stuff like that. But I still go on dates, and we've gone to the movies, and so.
Was it strange for you that you fought this one way for so many years now, and now all of a sudden everything's changed? Do you think differently, or has it sunk in really that your life is now different from what it was before? Or is it, yeah, this is great, I won the lottery, and...
Oh yeah, it's different, and but any time I get like annoyed, like I'm still losing a lot of hair. I don't know why I'm still losing a lot of hair. So I have bald spots on the top, and Paul was really nice this morning. I was like, I haven't noticed, but I'm like, how could you not notice? So little things, I don't know why I'm doing that. I know it's something they ask me when I go to the doctor, so it must be part of it. But it's like in the long run, I mean, someone's dead and I'm alive, so I think, oh well, if I have really thin hair, big flip, and if I have to wash my hands, and our whole family has to wash their hands a lot, and we have to bleach our countertops a bazillion more times, it's a bit, the alternative is I could be dead, so it's much better.
Because you were prepared for that, weren't you, really?
Yeah, and that's something I never thought I'd say anything good came out of. I thought I'd never say anything good came out of